with Central Ohio Spine and Joint. What I wanted to show you today was a little bit of dry needling technique. We've got a patient of ours here who's a runner, and a very common injury that we see or pain that we see associated with running is heel pain or arch pain. And the most common diagnosis that we see with that is people come in and they say, oh, I've got plantar fasciitis. And actually a lot of times what happens is trigger points within either the calf or some of the deep muscles in the foot can actually recreate some of those symptoms similar to like having plantar fasciitis. We've got a trigger point here today that we're going to treat that's actually in the bed of the soleus muscle. This trigger point actually likes to refer into the heel itself. So I'm going to have her zoom in here for me. I'm going to show you. So what we do is we palpate the tissue, find a trigger point. Again, a trigger point is just kind of a taut band or a little bit of deep spasm within the muscle. We find that trigger point. The patient can tell you here we're right on it right there. You're going to see just a little pop with the needle. Nice and easy. We're going to slide the needle right into the trigger point. And that's it. We're going to put a couple more in, a couple different other areas here. One up actually into the gastroc as well. Okay, and that's all we're going to do today. So as the patient sure could tell you here, very non-painful. The needles themselves, you really hardly even feel them go in. Sometimes they can actually recreate some of the symptoms. That's a good indication that we're actually in the right spot. A lot of times too, you'll see maybe a little bit of twitch in the tissue. That kind of tells us that we've hit right on the trigger point itself.